My name is Pastor Lipava, and today we are going to discuss about blood pressure. Blood pressure is many health issue in Malawi because it's affecting many people. So today I have blessed with a guest who will be more insight about blood pressure. So I welcome you and beg you to introduce yourself.
Thank you so much. My name is Tony Khan, the health expert here.
Okay, so I want to know, what is blood pressure?
Blood pressure is the force of your blood pushing against the walls of your arteries. Each time your heart beats,
Yeah.
it pumps blood into the arteries. So your blood pressure is the highest when your heart beats, pumping the blood. This is called systolic pressure. When your heart is at rest, between beats, your blood pressure falls.
Yeah.
This is called diastolic pressure.
Okay. There are many types of blood pressure. So what are the main types of blood pressure?
We have two main types of high blood pressure. We have primary and secondary high blood pressure. So the first one is primary or essential. Or essential high blood pressure is the most common type of high blood pressure. For most people who get this kind of blood pressure, it develops over time as you get older.
Yeah.
So this is the primary high blood pressure, and the secondary high blood pressure is caused by another medical condition or use of certain medicines. It usually gets better after you treat that condition or stop talking about the medicines that are causing it.
Okay, so why do I need to worry about high blood pressure?
When your blood pressure stays high over time, it causes the heart to pump harder and work over time, possibly leading to serious health problems such as heart attack, stroke, talking about heart failure and kidney failure.
So what are the treatment for high blood pressure?
Treatments for high blood pressure include heart-healthy lifestyle changes and medicines. Heart-healthy lifestyle changes and the medicines. You will work with your provider to come up with a treatment plan. It may include all the lifestyle changes. These changes, such as heart health, eating, and doing exercise, can be very effective. But sometimes the changes do not control or lower your high blood pressure. Then you may need to take medicines. There are different types of blood pressure medicines. Some people need to take more than one type. So if your high blood pressure is caused by another medical condition or medicines, treating that condition or stopping the medicines may lower your blood pressure.
Okay, me and others, we want to know the symptoms of high blood pressure.
Usually high blood pressure causes no signs or symptoms. That is why healthcare providers call it a silent killer.
It's called silent killer.
It is silent killer because it has no signs or symptoms. So you could have high blood pressure for years and not know it. In fact, the World Health Organization estimates that 46% of adults with hypertension don't know they have it. So when your blood pressure is 180 or 120 mmHg or higher, you may experience symptoms like headaches, heart palpitation, or nose breathe. So blood pressure. This I mean, this high is a hypertensive crisis that requires immediate medical care.
Okay, you have said about hypertensive. So, what are the main causes of hypertension?
Primary source doesn't have a single
Mm.
clear cause. Usually, many factors come together to cause it.
Yeah.
Common causes include unhealthy eating patterns, including a diet high in sodium, lack of physical activity,
Yes.
the high consumption of beverages containing alcohol.
Mm.
Yeah, these are the primary ones. And secondary hypertension has at least one distinct cause that healthcare provider can identify, and this is common causes of secondary hypertension include kidney disease,
Yeah.
recreational drug use, renal vascular diseases.
Yeah.
So, which are the conditions that affect flow, blood flow in your kidneys, arteries, and veins. Renal artery stenosis is a common example. Tobacco use, including smoking, vaping, and using smokeless tobacco.
Okay, I want to know from you. Is blood pressure genetic?
Researchers believe genes play a role in high blood pressure. So, if one or more of your close biological family members have high blood pressure, you have an increased risk of developing it too. So, yeah.
Okay, which means blood pressure or high blood pressure is genetic.
Is genetic, yeah.
Okay, so what are the risk factors for high blood pressure?
Risk factors that make you more likely to have high blood pressure include having a biological family members with high blood pressure. We're talking about cardiovascular diseases or diabetes.
Yeah.
Being over age of 55.
Yeah.
Being black, having a certain medical conditions including chronic kidney disease. We're talking about metabolic syndrome.
Yeah.
Obstructive sleep apnea or thyroid disease. So having overweight or obesity.
Yes.
We're talking about not getting enough exercise, eating foods high in sodium, food rich in sodium. We're talking about smoking or using tobacco products and drinking too much.
Okay, so what are the complications of this condition?
Untreated hypertension may lead to serious health problems, including coronary artery disease, CAD.
Yeah.
Stroke, there's heart attack, peripheral artery disease. We're talking about kidney disease and kidney failure.
Yeah.
Complications during pregnancy, eye damage. Yeah.
Okay, so how is high blood pressure diagnosed?
Healthcare providers diagnose high blood pressure by measuring it with an arm cuff. Providers usually measure your blood pressure at annual checkups and other appointments.
Yes.
So, if you have high blood pressure, reading at 2 or more appointments, your provider may tell you that you have high blood pressure. They also talk to you about your medical history and lifestyle to identify possible causes.
Okay, so what are the treatment for high blood pressure?
High blood pressure treatments include lifestyle changes and medications.
Yeah.
Healthcare providers recommend treatment based on your blood pressure reading.
Yes.
The causes of your high blood pressure and your underlying conditions. So lifestyle changes, to lower your blood pressure. You may be wondering if you can lower your blood pressure naturally. Yes. Um, in some cases, it is possible to lower your blood pressure without medication.
Yes.
For example, your provider may recommend starting with lifestyle changes if you have elevation blood pressure or stages 1 hypertension.
Okay, so what are the proven ways to lower your blood pressure naturally?
Yeah, that's a good question. Keep a weight that keep a weight that is healthy for you.
Yeah.
Your healthcare provider can give you a target range.
Yes.
Eat a healthy diet. An example is the DASH diet. This is the way that eating that is full of fruit,
Yes.
vegetables, whole grains, and low fat diet. So cut down on salt. Limit your sodium intake to no more than 1,500 a day.
Yeah.
If this is too difficult at first, you can start by reducing your daily intake by at least 1,000 milligrams. So getting enough potassium. Try to consume 3,500 to 5,500 milligrams per day.
Yeah.
Ideally, through the foods you eat rather than supplements. Some foods high in potassium include bananas, avocados, and potatoes.
Yes.
With skin. Potatoes with skin. Exercise and ask your healthcare provider tips to get started in general. So start slow and wake your way up to 150 minutes of aerobic exercise per week. Resistance training like lifting light weight is also helpful.
Okay.
Yeah, and limit alcohol. We're talking about if you choose to drink beverages containing alcohol, do so in moderation. Sometimes providers recommend lifestyle changes along with medications to lower your blood pressure.
Okay, so what are the medications to lower your blood pressure?
4 classes of blood pressure medications are first line, most effective and commonly prescribed when starting treatment. We're talking about angiotensin converting enzyme (ACE).
Yes.
Inhibitors block the production of the angiotensin 2 hormone, which the body naturally uses to manage the blood pressure. So when the medicines blocks the angiotensin 2, your blood, the blood vessel don't narrow. So angiotensin 2 receptor blockers block this same hormone from binding with receptors in the blood vessel. So ARBs work the same way as ACE inhibitors to keep blood vessel from narrowing. Calcium channel blockers prevent calcium from entering the muscle cells of your heart and blood vessels, allowing these vessels to relax. Diuretics, this is the water or fluid pills.
Yeah.
Flush excess sodium from your body, reducing the amount of fluid in your blood. People often take diuretic with other high blood pressure medicines, sometimes in one combined pill. And your provider may couple other medications with these first line drugs to better manage your blood pressure. So talk to your provider about a possible side effect. If you get side effect that concern you, call your provider. They may change your dose or try a different medication. So don't stop taking the medicine on your own. You should avoid some medications during pregnancy.
Yes.
So be sure to tell your provider if you are pregnant or could become pregnant.
Okay, so can I prevent high blood pressure?
Fortunately, there are things you can do to reduce your risk of developing high blood pressure. Um, First one, follow a healthy eating plan.
Yeah.
This is an important step in keeping your blood pressure normal. The DASH diet, the dietary approaches to stop hypertension,
Yes.
emphasizing adding fruits, vegetables, and whole grains to your diet. Cut down on sodium to prevent hypertension. You should reduce the amount of sodium in your diet. So try to keep it below at least 1,500 milligrams a day.
Yes.
Keep a healthy weight going hand in hand with a proper diet is keeping weight that that is the healthy for you. Losing excess weight with diet and exercise will also help lower your blood pressure to healthier levels. Another one is keep active. Uh, Even simple physical activities such as walking can lower your blood pressure and your weight.
Yes.
Another prevention: drinking alcohol in moderation. Having more than one drink a day for women or people assigned females at birth, or more than 2 drinks a day for men or people assigned male at birth can raise blood pressure. So one drink is defined as 1 ounce of alcohol,
Yeah.
5 ounces of wine, or 12 ounces of beer.
Okay. What can I expect if I have a blood pressure?
Since since a high blood pressure doesn't cause symptoms, you probably won't to feel any different with a high blood pressure diagnosis, because it is important to follow your provider's instruction
Yes.
to bring your blood pressure down to it doesn't cause any complications later on. Once high blood pressure leads to complications, you may start to feel symptoms of conditions like coronary artery disease or peripheral artery disease. These include stable angina.
Yeah.
We're talking about shortness of breath, leg pain. Should I check my blood pressure at home? Your provider may recommend you check your blood pressure regularly with the home blood pressure monitor.
Yeah.
These are automated electrical monitor you can purchase at most pharmacies or online. For some people, 24 hours ambulatory blood pressure monitoring is necessary.
Okay, so how long does the high blood pressure last?
If you have primary high blood pressure,
Hmm.
you will need to manage it for the rest of your life.
Yeah.
If you have secondary high blood pressure, your blood pressure will most likely to come down after you receive treatment for medical problems that caused it. So if a medication caused your high blood pressure, or switching to a different medicine may lower your blood pressure.
Okay, so when should I see my healthcare providers?
See your provider for yearly checkups. They will monitor your blood pressure and recommend treatment if needed to help you stay healthy. So if you have sudden symptoms for hypertensive crisis, these include shortness of breath, headache, we're talking about chest pain, heart palpitations, anxiety, dizziness, nosebleed, vomiting, then you need to see the doctor to to that she or he will help you with a good treatment.
Okay, so eventually, what's your advice to people who are affected or not affected?
Ah, I like that question.
Yes.
High blood pressure is a serious but silent condition that can sneak up on you over the years. Seeing a healthcare provider for regular um, checkups, checkups can help you learn your numbers. So if you don't have access to care, learn about available community resources such as wellness fair, where blood pressure checks are available. And knowing your blood pressure level is the first step toward making lifestyle changes that can help keep your arteries healthy.
Okay, so to reach this far, let's make our discussion for today. And our expert has explained more about the high blood pressure, types, complications, and how we can prevent it. So, thank you for giving us the stunning information like this.
Also, thanks for recognizing me.
God bless you.